How to interpret borderline IGRA TB test results. Have you ever wondered what it means when a tuberculosis test comes back with a borderline result? Understanding this can be crucial for your health. Interferon Gamma Release Assays, or IGRAs, are blood tests that help detect tuberculosis infection by measuring how your immune system responds to specific TB proteins. Two common tests are QuantiFERON-TB Gold Plus and T-SPOT.TB. When we talk about borderline IGRA results, it's important to note that these results fall into a gray area. For the QuantiFERON-TB Gold Plus test, results are typically positive, negative, or indeterminate. While there isn't an official borderline category, some healthcare providers consider results that are close to the cutoff, like between 0.2 and 0.7 international units per milliliter, as borderline. This indicates uncertainty about whether a TB infection is present. On the other hand, the T-SPOT.TB test does have a borderline category. This occurs when the number of immune cells producing interferon gamma is just below or above the threshold, usually around 5 to 7 spots. So, what does a borderline result mean for you? It suggests that the test did not provide clear information about a TB infection. This could be due to various reasons, such as biological variability, technical issues, or your immune response being very close to the test cutoff. Essentially, these results do not confirm or rule out TB infection. If you find yourself with a borderline result, what should you do next? One common recommendation is to repeat the IGRA test after a short period. This can help determine if the result changes to positive or negative, providing more clarity on your infection status. Additionally, considering a tuberculin skin test alongside the repeat IGRA might give you more information, especially if there is still a concern about TB. It's also essential to assess your personal risk factors for TB exposure. If you have a history of contact with someone who has TB, are immunosuppressed, or show symptoms, these factors should be considered when interpreting your results. In low-risk individuals, borderline results might indicate a false positive or simply test variability. When looking at the quantitative values from your test, those close to the cutoff, like 0.35 international units per milliliter, may fluctuate more. Therefore, cautious interpretation is warranted for borderline results near this threshold. Keep in mind that there is no standardized guidance on using these quantitative values for clinical decisions. A single borderline result should not be the only factor in diagnosing or excluding TB infection or monitoring treatment response. Ultimately, the interpretation of borderline IGRA results requires professional clinical judgment. Your healthcare provider will consider your entire clinical picture, including symptoms, risk factors, and any potential exposure to TB. This comprehensive approach will guide decisions about further testing, treatment for latent TB infection, or evaluation for active TB disease. In summary, borderline IGRA TB test results indicate uncertainty. They require careful follow-up testing and clinical correlation. They do not confirm or exclude TB infection on their own. Proper interpretation involves combining test results with your individual risk factors and possibly additional tests to ensure you receive the best care. Always consult with your healthcare provider for personalized medical advice.